Treatment strategies for acute respiratory distress syndrome include early detection and management of contributing etiologies, supportive therapy to prevent progression of lung injury, and prevention of complications such as pneumonia and stress ulcer. Traditional therapy includes intubation and mechanical ventilation and kinetic therapy. Intubation and mechanical ventilation is the artificial airway insertion with mechanical ventilation. Some of the nursing action would be to monitor ECG, oxygen saturation, lung sound, and color, sedate as needed, provide reassurance to calm the client, have suction equipment, manual resuscitation bag and face mask available at all times, and suction secretions as needed. For pre-intubation, nurses must oxygenate with 100% oxygen and have emergency resuscitation equipment readily available. For post-intubation, assess end-tidal carbon dioxide levels, bilateral lung sound, symmetrical chest movement, and chest X-ray findings to confirm placement of the endotracheal tube. Secure the endotracheal tube per facility guidelines and assess a balloon cuff for air leaks periodically. Post-end expiratory pressure, or PEEP, is a positive pressure which is applied at the end of the expiration to keep the alveoli expanded. PEEP is added to the ventilation setting to increase oxygenation and improve lung function. Client education is to explain all procedures to the client, reassure and calm the client, explain to the client and family that the client will be unable to speak while the endotracheal tube is in place. Kinetic therapy. A kinetic therapy involves a bed that rotates laterally and alters client's positioning to reduce atelectasis and improve ventilation. Nursing actions would be to begin therapy slowly and gradually increases the degree of rotation as tolerated. Monitor ECG, oxygen saturation, breath sounds, and blood pressure. Stop rotation if the client becomes distressed. Provide routine skin care to prevent skin breakdown and sedate as needed. Client education would be to explain all procedures to the client. Some of the possible complications of the procedures would be trauma, altered position of endotracheal tube, infection, and blocked endotracheal tube.